Verzenio tablets is used to treat certain types of breast cancer. Abemaciclib works by slowing or stopping the growth of cancer cells. It belongs to a class of drugs known as kinase inhibitors. Dosage and administration. Recommended dose and schedule. When used in combination with fulvestrant or an aromatase inhibitor, the recommended dose of Verzenio is 150 mg taken orally twice daily. When given with Verzenio, refer to the full prescribing information for the recommended dose of the aromatase inhibitor being used. When given with Verzenio, the recommended dose of fulvestrant is 500 mg administered on days 1, 15, and 29, and once monthly thereafter. Refer to the full prescribing information for fulvestrant. Pre-perimenopausal woman treated with a combination of Verzenio plus fulvestrant shall be treated with a gonadotropin-releasing hormone agonist according to current clinical practice standards. When used as monotherapy, the recommended dose of Verzenio is 200 mg taken orally twice daily. Continue treatment until disease progression or unacceptable toxicity. Verzenio may be taken with or without food. Instruct patients to take their doses of Verzenio at approximately the same time every day. If the patient vomits or misses a dose of Verzenio, instruct the patients to take the next dose at its scheduled time. Instruct patients to swallow Verzenio tablets whole and do not chew, crush, or split tablets before swallowing. Instruct patients not to ingest Verzenio tablets if broken, cracked, or otherwise not intact. Who should not take Verzenio? The following conditions are contraindicated with this drug. Check with your physician if you have any of the following. Conditions: low levels of a type of white blood cell called neutrophils, severe liver disease, excessive diarrhea, abnormal liver function tests, pregnancy, a patient who is producing milk and breastfeeding, lung tissue problem, child PU class C liver impairment. Precautions. Before taking Abemaciclib, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Before using this medication, tell your doctor or pharmacist your medical history, especially of liver disease, bleeding, clotting problems, such as bleeding from intestinal stomach ulcers. Since this drug can be absorbed through the skin and lungs and may harm an unborn baby, women who are pregnant or who may become pregnant should not handle this medication or breathe the dust from the tablets. What are the possible side effects of Verzenio? Verzenio may cause serious side effects including nausea, infections, low red blood cell counts, anemia, decreased appetite, headache, hair thinning or hair loss, alopecia, abdominal pain, tiredness, low white blood cell counts, leukopenia, vomiting, low platelet count, thrombocytopenia.